Hi, my name is Tisha. I'm hoping you can see me in this video. I'm at work, but I will be using one of the patient's dolls as my baby for the assessment, the head to toe. This is her warming bed in pretend, and I am getting ready to start my video. I do have a point of reference, which Ms. Valerie said it's okay to glance at if we needed to. So, let's just get started. Knock, knock on the door. Got my hand sanitizer. I'm hand sanitizing my hands. My name is Tisha. I'm introducing myself to Mr. and Mrs. Deer. Congratulations on your beautiful baby girl. Looks like her name is, now I do have gloves on, so I will be touching her. Bambi, date of birth, blah, 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 which is correct. I'm just here to do an assessment on her, a quick head to toe that we do on all babies, just to make sure that everything's going in the right direction and that there's no concerns that we need to address. So I'll be examining her from head to toe. We'll start at the head and I'll work my way down. If you have any questions, feel free to ask. So getting started, I just want to reference that everything on your baby's face looks symmetrical where it's supposed to be. The eyes are lined up at the top of the ears. The nose appears to be patent. So I'm checking that. Now with my gloved finger, I'm going to go ahead and stick it in and check for any cleft palate or swollen gums, which would be normal. And looks like her sucking reflex is intact, so that's all good news. I do have to pick her up just to check the fontanelle. So I do see she has the anterior and the posterior fontanelle with no bulging. They both look normal and feel normal. So I'll go ahead and lay her back down. She's a very cooperative baby. Next, we'll be going over her neck. So I'm going to rotate her neck this way. And then I'll rotate her neck that way. And as her arms kind of flex backwards, that's a normal reflex. So that looks good. Now I'm gonna check her chest out, and I just kind of feel. So if you can see, there's a little bit of a bulge where her nipples are. That's normal. There's nothing weird about that. Even if she may have a little bit of drainage come out of it, white drainage, that is also normal. Her umbilical cord has been cut, and it is nice and dry and clamped. So no issues with that. Her abdomen is a little bit distended, but that's normal for babies. I'm going to go ahead and put my stethoscope on and listen to her bowel tones. So go ahead and listen to all 4 bowels. Everything is moving correctly. I'm also going to pretend that this is a pediatric stethoscope and listen to her heart rate for a full minute, which we have done. Also going to check her brachial pulses on the inside of her arms for a full minute. While doing that, I'll be also checking her respirations. So we do have a set of vitals on her. One last thing, let me get her temperature under the arm, in the middle of the axilla for as long as it takes to beat. Perfect. So for vital signs, we've got them, let me write them down. I have respirations of 50, a heart rate of 140, a blood pressure of I didn't write the blood pressure down. We'll have to get the blood pressure at the end. And then a temperature of 98.7. So that is all good. And then just taking a really good look over her skin. Looks good. Her skin is covered with milia, which is normal. Little white hairs everywhere. That is normal, and this is called vernix. This white sticky substance you feel, that is also normal. That comes out of the birth canal with the baby protect her skin, give her some isolation. So that will come off with some bathing, but it isn't harmful to her at all. So now that we've checked her chest, her abdomen, I'm going to just check her frontal vaginal area, and we'll just pretend that I looked at it. There's no drainage, which if there was a little bit of drainage, it could be normal, but there's none right now. Everything looks good and intact. I'm going to pick your baby up, and I'm going to be careful to keep her neck straight. And I just need to check her back to make sure that she doesn't have any weird curvature. Everything looks good there. Nothing strange about her spinal column. So go ahead and lay her back down. Next, we're going to be checking to see if she has any hip displacement. So we'll go ahead and do the assessment for that. We'll rotate her hips in and out, and I don't hear any weird noises, and she's not showing any signs of distress, so that's good. Also checking the range of motion of her arms. Clavicle and arms seem to be intact the way they are supposed to be. The legs look good. Pulses are good. Skin is a little bit bluish in color, but that's normal for any babies under 24 hours. Should return to pink after that. The length of the baby is 50 centimeters, which is average. And I've measured from the top of her head to her feet, and also the circumference of the baby's head. And I've got that at a 33 centimeters, which is also very normal, Mr. and Mrs. Deer. Lastly, the bed did weigh her. She is a whopping 7 pounds, and that is also good news. Nothing discerning there. So far, everything is looking good. I have no immediate concerns. Sounds like all of her reflexes are good. She's able to, you can tell that I'm not, the hearing test is not exact. She's obviously, it's a lot of things at this point that could influence that, but everything looks good so far. Right now, she can't see very good. That will improve as she gets older quickly. But one thing I do want to talk to you about as far as her education. I know you guys are excited to get her home, and you'll be leaving tomorrow morning. I know they already did the car seat education with you and the feeding education, but I did want to just mention about the cord, the umbilical cord. The cleaning of the cord, you're going to want to make sure you keep it clean and dry. You don't have to put anything on it to keep it clean and dry. You can wash around it with warm water and a soft cloth. Just want to keep the diaper away from it, so when you do change her diaper, just fold it down to make sure nothing is really covering it, and that goes for anything that would have any moisture to it. The actual umbilical cord will fall off on its own without your help in the next 1 to 2 weeks. So just cleaning around it, making sure there's no weird drainage or redness or smell. And if any of those things happen, just go ahead and bring her in and we'll check her out. Do you have any other questions for me? No? Okay. So as far as I can tell, her APGAR score is good. She should be good to go. We'll do some more assessments on her as the day goes along. We'll also be giving her a few medications if they haven't already, and go ahead and discuss bathing with her when you get ready to discharge tomorrow. So if you don't have any other questions for me, we did get a blood pressure on the baby. It was a whopping 70 over 34, so that's good too. Okay, so after I take my gloves off, wash my hands. I'll go ahead and document my findings. I don't know if you could tell, but the curtain was closed already when I came in, so that was the privacy check.